Hi, welcome to Innovate Training. My name is Carol Peugeot, and this is Miss Carol's Refresher Course. We are taking a break from our accounting lessons, and we're going to enter into medical billing. So today we're doing Lesson 1, Explanation of Benefits. Getting paid. That's what we all want. We want our providers to get paid. Your office can keep reimbursement process consistent by submitting your claims on a regular basis. A consistent cash flow. Submit your claims on a daily basis and your cash flow will be more consistent. The one thing I know for a fact is Medicare is very consistent on how they pay. We used to submit our claims daily and we'd get a check twice a week from Medicare. So you want to make sure you are consistent with your Medicare. So you want to submit a claim. There are two types of claims that you can submit. There are paper claims and there are electronic claims. Now a paper claim is just like it sounds. I will enter into the information into my computer software, the practice management software, and that will generate a claim. I will print that on a claim form, and I will put that claim form in an envelope and send it to the insurance company. The insurance company will receive it and then they'll process it. Paper claim. That will take 4 to 6 weeks for processing. So think about if there's an error on that claim. You send that claim to them, it's going to take 4 to 6 weeks for you to even know that there's an error on that claim. So they'll send back a form saying you have an error on the claim, so you'll resubmit the claim, and then you realize it's going to take about 8 weeks to get paid. So that's a paper claim. Now those are going to be far and few between because today more and more insurance, especially Medicare and Medicaid and all the government programs, require electronic claims because they're easier to process for the provider as well as the payer, the insurance payer. So let's talk about an electronic claim. Just like an email, electronic claim goes through the internet. And so you would bundle all your claims with your software and submit it, and the carrier will receive it automatically. It takes 7 to 10 days. And the good thing about that is if you have a clearinghouse, which we'll talk about clearinghouses a little bit more in a couple lessons when we talk about reimbursement. But a clearinghouse will scrub your claims, and that's exactly how it sounds. They'll read your claim, and if there's any information, they'll kick it back to you. So right then and there, you can fix whatever's missing, and then untag it and send it right back. So you can all do that in 5 minutes. So 7 to 10 days, maybe 14 at the most, you'll get a check. So that's the ideal way to get paid. All right. You submit your claims. There's 4 ways they're going to respond, the insurance company that is. The first one is they're going to pay. That's the ideal. You want them to pay. The second one is they're going to reject the claim, or they're going to deny the claim, or they're going to pend the claim. So let's talk about those 4 things. Reject or payment. I don't have to tell you about the payment. It's just as it sounds. You submit the payment, or you submit the claim, they pay. Post the payment, the claim is now closed. If there's any left over, you would send that to your secondary or the patient's. You send a statement to the patient. The second one is rejection. If they reject the claim. A rejection is a claim that is returned based on a technical issue, such as missing information, the claims are misspelled, there's a name misspelled, or you have the wrong ID number in there, the date of birth is either missing or wrong or incorrect, or you may have it formatted incorrectly. A rejected claim can be corrected and rebilled. You don't have to file an appeal or anything else. You can just make the correction and rebill it. So you don't have to worry about anything like that. Now there's some special rules when it comes to Medi-Cal, but we'll talk more about that when we talk about our insurances. The next one is denial. When they deny the claim, they're returning the claim based on a policy issue. So it's not that it's missing information. This is because there's either a lack of medical necessity. What that means is the diagnosis doesn't warrant the procedure that you're billing for. The diagnosis isn't severe enough, or it's the wrong diagnosis, or it's the wrong ICD-10 code, or the patient's policy is expired. They didn't pay their premiums, or they no longer work at a place, they no longer have the coverage, or it's not a covered service. For instance, maybe they have major medical only, and major medical covers only catastrophic type care, like a hospital or surgery. It doesn't cover routine. So that would be, if you billed for an office visit, they would deny it based on it's not a covered service. So that's a denial. A denial, you cannot fix it and rebill it because the problem is inherently with the claim itself. So you would have to file an appeal. Now, who files the appeal will depend on why they're denying it. If it's based on lack of medical necessity, it's probably going to be the provider who's going to appeal it. If it's based on coverage or the patient's policy, the patient may have to call and file the appeal. So we'll talk more about that when we get into the insurances. So it cannot be corrected and rebilled. You must file an appeal. Or they can pend the claim. Pending the claim is just like it sounds. The claim is put on hold. For some reason, they're holding the claim because they don't have enough information to process it. So there's a couple circumstances, such as certificates of medical necessity. A lot of times we have trouble getting the doctors to send those in, or the patient is sent a letter that they need to sign verifying that those services were rendered. So usually after about a couple times that the patient has not sent it in, I will call the patient and say, "Hi, Mrs. Jones, this is Carol from Dr. So-and-so's office. I'd like to know if you would have sent that in, or would you like me to send you the statement?" And more than likely they'll send it in. So that's a pended claim. So let's talk about EOBs, or otherwise explanation of benefits. Medicare and Medicaid, in California we call it Medi-Cal, call these remission advice, RAs. So EOBs are RAs. What these are a document. Now, whether a claim gets paid or denied, it will come with what's called an EOB or an RA. And usually, well, especially if it's Medicare or Medicaid, they're going to be mixed in. So you'll have some claims in there that are paid and some that are denied, some that might be paid and some that might be denied. So this is a document that accompanies the payment. If you received an electronic payment, then you're going to get an electronic RA, or remission advice, or EOB, or a paper one if you received a check. It indicates the status of the claim and also the breakdown of the payment. So if benefits are not assigned, however, you will receive an EOB, but the check will go to the patient. And what I mean by assigned is the assignment of benefits is when the patient signs over the benefits to the provider. And we'll talk more about that when we talk about billing to begin with. So if you are a preferred provider, a participating provider for Medicare or Medi-Cal, you have to be a preferred provider and you have to accept assignments. So it's not even a question. So let's talk about an EOB. Interpretation of it. Now, the problem with the EOBs is that each insurance company has their own design. They all look different. They may reflect one claim, one patient on the claim on the EOB, or they may reflect 100 patients on there, many patients. So it really depends. Like Medicare and Medicaid usually are more than one. The bigger or the smaller insurances usually may have one or two patients they may reflect. So for instance, you may only have one Aetna patient that you saw this week. So you would have only one Aetna patient on that EOB. Whereas you probably had 30 or 40 Medicare patients that you saw. So this check's going to reflect those 30 or 40 Medicare patients. So when you're interpreting the EOB, you want to look for specific components of it. Like I said, they all look different. So if you understand these components, you'll know how to look and find the information that you need. So the components are the breakdown of the payment. That's probably the most important thing. It will indicate how much the insurance was billed, how much the insurance allows, and then how much the insurance pays, then how much the patient is responsible for. Those are the important pieces of information you want to look for. And those will all depend on the patient's policy. So if you look at this EOB, this has several different components. It has, number one, the amount paid. The amount paid is how much the check is. And then the total billed. The total billed is going to be more likely different from the amount paid, because there's going to be things that are denied or things that are not allowed, or the difference between the allowable and the charge. And then number three is the patient's savings. Now this is a good example. Here they call the patient's savings as something that they are not responsible to pay. But we call it as the amount that we have to write off. So this looks like it's an EOB that's meant to be read by the patient. Because remember, a patient also receives a copy of an EOB. And then number four, the amount applied to the deductible. 5, co-insurance. Now remember, deductible, co-insurance, and co-pay are 3 completely different things. We'll talk more about those when we talk about the insurance, probably in the next lesson or two. But it's very important for you as a biller to know the difference, because you'll need to explain it to the patient. I don't know how many times I've had patients call me and said, I got a bill, or I paid my deductible last month, and my deductible is paid. They don't really sound like that. My deductible's been paid, so why are you sending me a bill? Well, then I have to explain to them that they have a 20% co-insurance that they have to pay. So once the deductible's been met, then Medicare comes in and pays 80%, and the patient's responsible for 20%. So, and then the amount, WO, means write-off. All right, so other components, we have the insurance company. That's going to be on the EOB, of course. The provider of services, who provided the services, what the doctor's name or even the clinic. The date of services, that's important because you're going to need that to be able to post it to the correct date of service and the correct procedure. The procedure code, the CPT or the HCPCS code, the amount billed, the amount paid, the claims control number, which is an important number you'll need to refer to if you need to contact the insurance to follow up with this claim or to talk about the claim if there's a problem with it. The co-pay, co-insurance deductible amount, and then the total paid by carrier. All right, so this is another example of an EOB. It looks very complicated, but like I said, if you know what to look for, you'll know where to look and what areas you need to get the information that you need. So what we're going to do is we're going to look at an example of an EOB. Okay, so let's look at this example. This EOB, or RA, remember what RA stands for? Remission Advice? Calculations exercise. We're going to do the top line here. Christina Rodriguez has Blue Cross that pays at 70/30. So what does that mean? It means that the Blue Cross pays 70% of what's allowed, and then the patient is responsible for the 30%. That's Christina's co-insurance. Remember, a co-insurance is always going to be based on a percentage, whereas a co-pay is a set amount that's paid each time of service. So if you have a co-pay of $20, that's a $20 co-pay. It's a set amount that's paid every time the patient has an office visit. And you don't pay a copay for every service. You pay mostly for prescriptions or for office visits. Okay? But a co-insurance is going to be based on a percentage. A deductible, on the other hand, is an amount that the patient must pay out of pocket before the benefits will begin. So let's say they have a $500 deductible. The deductible, $500, must be paid out of their pocket. So the first $500, the insurance doesn't even look at. They say that's the patient's. Once $500 has been billed to the patient, the insurance doesn't care whether the patient pays it or not. Keep that in mind. All they care about is that first $500 they're not responsible for. It's your responsibility to collect it from the patient. Once $500 has been met, then the insurance will come in and pay at the whatever percentage that they have agreed to in their policy. Okay? So, co-insurance based on a percentage, co-pay a set amount paid at the time of service, deductible an amount that must be paid out of pocket before benefits begin. And that's usually yearly. Okay, so let's look at Christina Rodriguez. Look at the procedure code 99213. The date of service was January 2nd, 2021. The 99213 is about a third level office visit. And they charged $125. It says here allowed amount is $111.42. What they want to know now in this next column that I left it blank, because you have to figure out how much is not allowed. What it means by not allowed is that much is not allowed by the insurance, so you have to write it off. So how much has to be written off? Well, you just take the $111.42, subtract it from the $125, and you get $13.58. So $13.58 must be written off, and that's going to be the amount that you put under not allowed. Now the insurance is going to pay. And notice how the deductible is zero, because up here it says the deductible has been met for the year. So once the deductible has been met, it's gone until the next year. So, wow, it's January 2nd, the deductible's already been met. Hey, maybe they had a deductible on the 1st, who knows, whatever. Okay, so how much is the insurance going to pay? They pay at what percentage? 70%. 70% of what?
Of the allowable.
Of the allowable amount. So that's the $111.42. So you just take the $111.42 times 70%, and you get $78.99. Let me make sure I did that right. 111.42 times 70% equals $77.99.
Handy dandy calculator.
I was checking on you. I was checking on you to check me, because you're supposed to be doing this along with me, right? So it's $77.99 is how much the insurance is going to pay. Now the next one they want to know is the patient's co-insurance. Now remember I said the co-insurance is also always based on a what?
Allowable.
Percent. It's always based on a percent. So the insurance pays 70, the patient's responsible for 30. Now there's two ways you could do this. You can multiply the 111.42 times 30%, but I'd rather you take the 111.42, subtract how much the insurance paid. The reason is sometimes when we do it with the percentage ways on this deductible, on this coinsurance, because we end up with half pennies.
Yeah.
Especially when you get a large check, you're going to end up with a half penny off or 2 pennies off, and it just makes a nightmare out of your accounting. So just take the 111.42 and subtract the 77.99, and what you get is $33.43. That's the patient's what? Co-insurance. Now the deductible here is going to be what?
Deductible's already been met.
So it's 0.
Correct.
So the deductible's been met, so there's going to be 0. So what I want you to do is I want you guys to do the other two in this particular section here. There's a 77548 and a 76358. By the way, other than the 99213, I made up these CPT codes. Don't look them up and say, that's not a CPT code. I just made it up in my head because I'm going through these EOBs and I'm making things up. It's all about the numbers. We'll talk about coding when we get to the coding. But don't look these up and say, that's not what it's supposed to be. So don't do that.
Do they sound like that?
Yeah, that's what they sound like.
Oh, okay.
So don't do that. So here's your homework. For this week, in the comments below, or the directions, or whatever it's called, below.
In the description.
Description.
That's
I don't know why I can't get that word. I got to put a sign. Description. 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 In the description below, there is a EOB exercise I want you to do. We're going to do the same thing we just did. You're going to figure out how much you have to write off, how much the insurance is going to pay, and how much the patient's responsible for, based on the information that I give you here. I give you information that what percentage they pay at, and then you have to calculate it. In the description below, there will also be an EOB exercise key, so you can check your answer.
And all you have to do is click on the link below and you'll go to the resource page.
Click on the link below, you'll go to the resource page, you will find that exercise. So the EOB exercise 1. And then in the keys, the EOB exercise 1 key. Okay? I would suggest using a pencil because when you're writing these numbers, you make mistakes, it's just easier. You don't have to use whiteout. To use a pencil as opposed to a pen. Use a calculator. And then we'll talk about this more next week. We're going to talk about billing, and we're going to talk about a little bit more about the deductibles, co-insurance, and co-pays. So, see you next week. This is Carol Peugeot from Innovate Training, and I'll see you in class. Bye-bye. Hi, this is Carol Peugeot, and don't forget to subscribe, to like, and to hit that bell because we got a